So you may be having dizziness or vertigo and you've been referred to an ENT. What does that mean when you talk about having dizziness or vertigo? What can cause it and why do you need to see an ENT? Well, you see an ENT because we specialize in dizziness and vertigo. Dizziness is usually we talk about being lightheaded, feeling like you're going to faint or pass out. Vertigo just means feeling a false sensation of movement, like you're moving when you're not or the room is moving when you're not. People can say you have vertigo, but that's kind of like saying I have a headache or foot pain. It's a symptom, it's not a diagnosis. So what's really important to think about when you go to an ENT's office is, what are you feeling? Do you feel like you're gonna faint or pass out, especially when you stand up? Do you have heart palpitations with it? Do things get dark in front of your eyes? Or do you feel like the room is spinning? Is it just a little bit, or is it violently spinning? And how long does it last for? Does it last for seconds to a minute? Does it last for minutes to hours, or is it for days straight? Because that helps us figure out what's causing it. Also want to know, do you have any change in your hearing with it? Do you hear any noises or ringing in your ears? Or do you have fullness or pressure in your ears? One other thing to think about is, do I have headaches? Do I have a history of migraines? Am I getting a headache with this? Or do I sometimes feel like when I walk, I'm walking on a ship that's off balance? Or do I have trouble thinking? Is my brain foggy? And is it something where it lasts all day and comes and goes? Or is it just specific episodes that happen kind of when you roll over in bed? So based on what you tell me, we're going to talk about different causes. Vertigo, the sensation that the room is spinning, can be caused by a problem with your inner ear, but it can also be caused by a central process, meaning it's with the brain. Vertigo with the spinning that lasts for seconds to a minute is often caused by a crystal out of place in your inner ear called BPPV, or Benign Paroxysmal Positional Vertigo, but we'll say BPV because it's easier. When this crystal, which is supposed to be in the inner ear, gets in the wrong place in these what's called a semicircular canal, if you can imagine these little canals deep in the inner ear, when you move your head, they detect movement, and the fluid moves around in this canal in a circle. And they're tiny hairs that detect movement of the fluid. Well, if the crystal gets in there, it causes turbulent movement of the fluid, and hair cells are moving everywhere. And going through a special pathway from the inner ear to the brain, it actually makes your eyeballs spin when you roll over in bed. And that's why the doctor will lean you back to look and see if your eyeballs are spinning. That tells us that there's a crystal out of place. Now, it doesn't always do that. That movement of the eye is called nystagmus, and that's what we're looking for. There's a specific type that we look for that will tell us it is BPPV, and you can have a maneuver done either by an ENT or a physical therapist, and even at home, it's called a self-epi, that you can find online that can treat this. Now, again, if you do this at home and have a self-epi and you're not better, you need to see a doctor for this. The other thing we look for is if you have a really bad spinning that lasts hours long, it's really violent, you're throwing up, you feel awful, you can have a viral inflammation of your inner ear, and usually that lasts for a day or two of spinning, and then it gets better, you feel off balance for about a week or two, and it goes back to normal. The reason to get looked at for this is that the same symptoms of violent spinning lasting for minutes to hours straight can also be the sign of a stroke of the back part of the brain called the cerebellum. So if you're someone that's middle to older age, that you have high blood pressure or at risk for something like a stroke, you should get looked at often in the urgent care or emergency room, because we want to make sure that that's not what's going on, because it's something that can be life-threatening. Whereas if you have a viral inflammation in the inner ear, it's going to get better, but that needs to be determined by the doctor. The other types of vertigo are ones that we see that are chronic, meaning they keep happening over and over again. So we break that down into two types, which is something that's related to a buildup of fluid in the inner ear, which is endolymphatic hydrops or Meniere's. And then often the most common reason people present for vertigo is actually related to a migraine, which we call migrainous vertigo or vestibular migraine. True Meniere's disease, which is a buildup of pressure in a tiny part of the inner ear called the endolymph system, that the sodium and potassium in your body get out of balance, you get too much sodium in the body, that endolymph system swells, it can make you feel fullness in your ear, it can make you feel pressure in your ear, it makes you have loud ringing, and at the same time you have hearing loss that can come and go, meaning it fluctuates. And you also have the sensation of vertigo with the room spinning for minutes to hours, usually at least 20 minutes at a time. You get the fullness, the ringing, the change in hearing, and the vertigo all at the same time. So in the workup for that, we're going to get a hearing test, which will look for a low frequency dip in your hearing. Oftentimes with vertigo of any type, we're going to get a more complicated series of tests, a very comprehensive balance test. We look at something called a VNG, and you sit on a platform, and we call it dynamic posturography. We have a rotary chair, but we may do a very comprehensive set of balance testing in one of our offices to see what's going on with the inner ear, and we can test for Meniere's in certain patients with that. If you have Meniere's, we often treat that with a diet modification to watch your salt and caffeine intake. Sometimes you'll get a water pill, a diuretic, to smooth out the salt in the inner ear. And in severe cases, you can get injection of steroids through the eardrum if it's not getting better. The last thing we talk about is what we call vestibular migraine. So often patients will come in, they get these symptoms where they feel like the room is moving at times. Sometimes they get severe vertigo, but sometimes they just feel off. Sometimes they feel like the room is the floor is moving like you're walking on a ship, or their brain is foggy, they can't think straight. And many times it'll be associated, not always all the time, but sometimes with headaches, where you're sensitive to light and sound, you get nauseous, it gets better if you lie down in the dark, a throbbing headache, which are classic for migraine. We often see that in people who had migraines when they're younger, and then later on it presents again. There are medications that you can take daily to suppress this migraine activity to help with this. There's also diet changes and making sure you get good rest, like good sleep, a good diet. And in many cases, we'll send you to neurology if the medications that I can try aren't helping with that. But again, there are many ways to evaluate vertigo. If you have dizziness where you get lightheaded like you're going to faint or pass out, or if you get lightheaded standing up, sometimes it's related to blood pressure or issues with your heart. And if it's something that I feel is necessary, I will send you to a cardiologist for a more further workup. But if you have dizziness or vertigo, it's always very important to get looked at and get seen sooner than later, especially if it's severe vertigo lasting minutes to hours, to make sure that something that's harmful to your health can happen.